Danyo, how are you doing, man?
Clark, I'm doing great, as always. I hope you are. I know you are. You're
I
always
am.
great.
Well, you're always great. I love this. I love our conversations, and we've had quite a few conversations. And actually, believe it or not, this is episode 50, the big 50.
Nice.
It's a real thing, man. This is our 50th episode, our 50th conversation. We've covered so much over the years.
We actually started this conversation back during COVID. You remember that?
Yeah.
Yeah.
And that also messes with the timeline. Anytime I think back to those blurry days, it's like, wow. But we've been doing this for quite a while, and I love it because we just get to sit down and have these straightforward conversations. A lot of these are just like the most common questions you're getting. It covers a wide variety. So if this is someone's first episode, excellent. If they've been coming back to hear different perspectives, wonderful. So glad you're here. So a lot of great things ahead. And actually, this episode, we're going to be talking about, I'm sure this is sort of a subjective question, but what is the best treatment for hair restoration?
Yeah.
How would you answer that?
I don't know. No. I mean,
it's kind of a loaded question, right? It's sort
it's
of what's the best way to do this? But yeah, how would you think of it?
We talked about this before. When people come to me, there's a different problem, and then there's a different equation that I have to come up with. And that equation then goes into like our answer, which is going to ultimately end up being the results.
There's a formula. You got a little solution here, right? A little formula.
Yeah. So, part of the formula, age goes into it, because my discussion and my treatment plan for somebody who's, say, like 22 versus like sometimes I see people that are 72, or people that have a very strong family history or no family history, people that have fine hair versus thick curly hair, black hair versus salt and pepper hair. I mean, there are just so many things. The scarring alopecia versus patterned hair loss. What treatments have been done in the past? Has there been prior hair transplant? I mean, all of this stuff goes in. So I think with that equation, we just need to start breaking things down. So maybe let's say I'm your doctor and you're my doctor.
Okay, I'm doctor. Okay, Dr. Clark.
Yes.
Okay.
Yeah. So I'll go first. So
okay.
Let's say you were a patient come to me. I'd be like, man, thinking in my mind, you have so much hair. Why would you honestly come to see me? And then you pull your hair up and you've got this big scar that's hidden, by your frontal hairline. So a scar, I think the best treatment is going to be hair transplant. You know what I mean? There's not going to be medicine. There's not going to be injection that's going to bring that back. And you could get really great results with that. Now, you being the doctor and seeing me, I've talked about this before. I've had a couple hair transplants in the past. I could use some more, probably touch up my hairline and get a little bit more throughout. But you tell me you've been...
Well, hey, I would be, man, you came to me, I would say, hey, you look great. What are you doing here? Right. No, what I'm hearing you say is it depends. When I have this kind of vague question of what is the best treatment for hair restoration, it's sort of like, well, it depends. You never know someone's story. And even previously, we've talked about this. People, whether they're coming to see you, someone else, another situation, whatever it might be, one trap you want to avoid is just seeing a photo and saying, oh, I want to look exactly like that. You just don't really know what is a part of someone else's story. So being mindful about having realistic expectations, that's a common thing. I think we all should be remembering, and whether it's a hair restoration or just life in general, probably.
Yep. I mean, the thing is, we have some great treatments, and depending on where you follow the formula, I'm not going to go through all the different scenarios, but let's start with sometimes medical management is the way to go. I do consults. I don't just automatically say, oh, everybody's a hair transplant candidate. That wouldn't be ethical and wouldn't be right. And so the good news about medical management, especially for men with male patterned hair loss, is probably the most common thing that I see.
Patterned hair loss? What does that mean?
It basically means that there is a genetic component to where the hair really on the top of the head, because the hair on the top is genetically different than the sides. And that's why you see people that are bald up top and have nice thick hair on the sides and back. But those hairs on top are particularly negatively affected by dihydrotestosterone. They actually have receptors in genetically susceptible people, and it just sets a cascade of miniaturization and eventual almost like a plant that's you put in the closet, you don't water it, no light, it's going to just shrivel up and die. Kind of the same concept. So everybody has a different genetic clock. Sometimes it starts, I've seen as early as 16, sometimes it starts in the 60s, you know what I mean? But the crazy thing is 80 to 90% of men will have some kind of hair loss in their lifetime. It's a very small percentage of people that are blessed with no hair loss. So what I'm trying to say is that medical management, even like finasteride, does have sexual dysfunction associated with it. And it's real. There are a few people that say they have permanent sexual dysfunction, which is still somewhat debatable. But low dose, like 4 days a week of finasteride, has minimal chance for side effects, although I'm not saying it doesn't happen. If it happens, you can just stop it. But it works just as well as taking it every day. The studies show we have about a 75% chance of actually stopping hair loss. So a young guy with a strong family history of hair loss, and, there's obvious miniaturization and progression of pretty rapid hair loss. I mean, finasteride is something that can save it. So I think you need to kind of look at the risks and be like, I need to talk with somebody who's got some specialization in prescribing this and experience to walk me through this process so I can take it safely and minimize the side effects. Another great one is oral minoxidil. Everyone knows about topical Rogaine and topical minoxidil, but there's a pill form, and people really don't know that it exists. And the studies have been coming out, pretty significant, multiple studies showing better efficacy taking oral minoxidil rather than topical. Again, both of these treatments are available to be done safely. Oral minoxidil actually has a profile of safety that is less than a 1% chance of dizziness or swelling in the legs. So those are the major side effects. So it's very safe. And hair transplant, if it comes down to it, again, depending on kind of the diagnosis and what's going on, but historically, 95% of those grafts should take if everything is done properly, and there aren't other negative variables for healing involved. So we've got great treatments with great results. Again, we talked about the formula. It all depends.
It all depends. And I was also just thinking, as you're describing, how so much of this does depend. There's different things for different times with different people's histories. A lot of times, I would imagine the best treatment is going to require the best team. And what I mean by that is you need to be talking to a medical doctor. You need to talk to someone who has the experience. These are not the kinds of decisions someone needs to be thinking on their own, because it's just such a complex world, and you've been in this for so long. Yeah. So it sounds like you're saying it's less about, just different vitamins, or it's less about shampoos. It's, there's a lot more that goes into the picture here.
Yeah. You brought up vitamins and shampoos and all that stuff. That can be part of the mix, you know what I mean? And I think you think of people in your life where you have a really positive influencer, and then you have somebody who's, an associate or something like that. I kind of look at the vitamins and shampoos really low on the list as far as influencers and having an impact. A lot of them are not scientifically proven, but clinically proven, and that's kind of a big difference. So I don't have great data or great experience to say, like, this vitamin works or this shampoo works, because it's very variable, and routinely it takes more medical interventions to have a higher success rate.
I was just remembering, as you're saying that about shampoos and stuff, you taught me something really important that's shifted my view on a lot of things.
Yeah.
Just because something is clinically tested, is that the phrase?
Yep.
Anything can be clinically tested, because they'll put that stuff, our shampoo is clinically tested. Just because it's tested doesn't mean it works.
Yeah.
It's not clinically proven. That's the difference, right?
A lot of these studies, there is improvement, but it can be negligible improvement for you in particular, but maybe better for somebody else. So, I would say it's not like this uniform thing. You pick up a bottle of shampoo or a vitamin, something, whammo, you're growing new hair. It goes back to that equation, and everybody's different.
I like that, the equation.
Yeah. But it can be quite frustrating if you're like buying all these different products and trying them out, and nothing seems to work. And maybe you're seeing doctors that are not really experienced doing hair, and they kind of tell you one thing and maybe put you on this or that, and there's not really good follow-up. It gets so confusing, and it really kind of halts things and can lead, actually. I mean, I've seen people that come to me, I mean, they're really depressed. I mean, they've been through a lot, and they just can't make sense of things online, like what's real and what's not, and who do I believe. So, we've talked about that in our, why we do this podcast. I mean, we're just trying to be sensible out there, just a voice where, just to help people out. And we're happy to help big time.
With this being the 50th episode, the world has changed a lot. I mean, of course, one thing has remained the same, and that's, hey, we all as humans, we like to compare ourselves to other people. But one thing that's changed a lot is you definitely, more today than ever, you got to be careful what you believe online. And now there's so many filters, there's so many, AI things. You just don't know what might truly be someone, a photo of something that's unrealistic. So it sounds like you got to, it's case by case. It all depends. You got to look at the full equation, family history, looking at background. Some things might work for someone else, whatever. There's a whole list of things that goes into this. And so that is part of the best treatment.
Absolutely. Yeah. And get the conversation going with somebody who kind of knows what they're talking about. And there are a lot of different doctors in cosmetics. And obviously hair is part of that cosmetic realm, but it has its own board. I mean, it's a lot more complex. It's funny because there's a doctor that I used to work with when I did a lot of hospital work. He said, "What are you doing, hair plugs now?" And I kind of drew him back in, and we talked for a while, and he said, "You know what? Now that we've talked, I mean, this is so much more involved than I ever would have thought. It's its own specialty." And I think going into that, as a patient, you need to recognize that there are great doctors out there and everybody's trying to help, but ones that are especially board certified or part of the ISHRS, which is the International Society of Hair Restoration Surgeons, and the IAHRS, which is the International Alliance of Hair Restoration Surgeons. Those are some of the top people really in the world. If you find somebody in those societies, I mean, that they're committed and going through the proper channels with updated webinars and updated information, journals. These are the people that are plugged into this great specialty, which really is hair restoration.
Well, I know that's been a big part of your journey, is being part of these, and I know you're a speaker at these conferences. When you go to these conferences, people are like, "Oh, you're Dr. Danyo." Like, you've been in this space a long time, and so congratulations on that. Congratulations on 50 episodes.
Yeah.
This has been so much fun, and I can't wait
Mark,
for...
I really appreciate you for hanging in there with me. No, I'm kidding.
Well, I learned a lot. Yeah, I'm looking forward to the next 50, right? I mean, this is a big world, and the end of it and why you do this, it's all about those high fives and hugs. It's all about, like you said, this is an emotional, taxing thing that people are going through. And so to be able to provide that custom support, that custom help to help someone find their unique formula, it's a big deal.
Yes.
Thank you.
Absolutely. Well, thank you, Clark.
Hey, thanks for listening to Hair Restoration with Dr. Daniel A. Danyo. Book your consultation today with Dr. Danyo by calling 678-845-7521 or online at nahairrestoration.com. And be sure to follow, rate, and review this show wherever you listen to your favorite podcasts.